I will return.
Thank you, Madam Chair. So we're here today to discuss the road ahead on the pandemic response, and I fear that that road will be a rocky one if we forget the lessons that we've learned thus far, particularly when it comes to our ability to make critical supplies like PPE in this country. A New York Times headline this summer declared, I quote, "A glut of Chinese masks is driving U.S. companies out of business." In response, I joined several of my colleagues in writing to the U.S. Trade Representative, Catherine Tai, to urge her to let tariff exclusions on Chinese PPE expire. The U.S. Trade Representative is currently weighing that decision. One reason these Chinese masks may be so cheap is that they are counterfeit, some of them. In fact, the FDA has pulled emergency use authorizations from several Chinese mask manufacturers. So I'm pleased that ASPR plans to use the Defense Production Act funds to procure masks and the raw melt-blown material needed to make N95s from domestic sources. I work to include that funding in the American Rescue Plan. However, government procurement can only support so much American industry. To retain a strong base of medical supply manufacturers and to reduce our reliance on foreign manufacturers as a whole, we need to prevent dumped and knockoff Chinese PPE from driving American manufacturers out of business as well. So first, Ms. O'Connell, are you concerned about the practice of dumping PPE from China, undermining the ability of domestic manufacturers to remain competitive in the U.S.? And if so, have you conveyed these concerns to the U.S. Trade Representative?
Senator Baldwin, thank you so much for this important question. We do participate in an interagency process where various departments have had the opportunity to share our support. So yes, we have conveyed.
Okay, Dr. Woodcock, the FDA has revoked authorizations for certain Chinese masks. Are you concerned that increased reliance on Chinese PPE will threaten the safety of U.S. healthcare workers? And if so, have you conveyed that concern to the U.S. Trade Representative?
Yeah, well, I can't answer the last part of your question. I don't know. I will look into the U.S. Trade Representative. We are concerned about lower quality PPE coming from anywhere, and we have, of course, put in import alerts. We have chased down and identified suppliers who have sent in counterfeits. We have tried to do recalls throughout the United States to get these off the market. We are interested in increased authorities because we do not have seizure authority for devices and several other authorities that we have been talking to staff about that would improve our ability to interdict these counterfeits.
Thank you. For Dr. Walensky, throughout the pandemic, we've heard about how gaps in the clinical and public health workforce have significantly hampered our response. In particular, we've long faced significant recruitment and retention issues among infectious disease clinical workforce and with health professionals who conduct outbreak preparedness and response activities. As this committee considers policies to better prepare for the next pandemic, I'm working to introduce the Biopreparedness Workforce Act with Senators Collins, Rosen, and Murkowski, which would create a new provider loan repayment program focused on encouraging students to pursue careers as infectious disease clinicians and biopreparedness professionals. Dr. Walensky, as an infectious disease physician and public health leader, I know that this issue is particularly important to you. And can you share your perspective on some of the serious workforce challenges I mentioned and how proposals to bolster this workforce might make a difference in responding to future outbreaks?
Thank you so much for those efforts, for your support, and for that question. We know that about 80% of people leave medical school now with debt. About half of those actually have undergraduate debt as well, and the debt for an average medical student is about $215,000. In terms of going into the field of infectious diseases, it is one of the lowest paying fields for all of medicine, all of the subspecialties. In fact, in most hospitals, if you are an infectious disease provider versus a generalist, your salary is less as an infectious disease provider. If we are going to bolster the public health workforce with infectious disease physicians, this kind of support will be essential. Thank you.
Thank you, Mr. Chairman, and thank you for being here this afternoon, or this morning. 11th hearing. This is the 11th hearing that this committee has had on the COVID pandemic. We had all, of course, hoped that we would be